Welcome to everyone who's joining us today on Earth Day. I'm going to spend the next several minutes talking to you about the health impacts of exposure to air pollution from industrial sites. Pittsburgh still has many industrial sites of pollution that are contributing to health impacts in our area. These sites include things such as coal-fired power plants, foundries, cokeworks facilities, and steel mills such as that found in Braddock. It's very well known that air pollution contributes to a variety of health problems. These problems include respiratory things such as asthma and chronic obstructive pulmonary disease, as well as respiratory infections. Air pollution also contributes to heart problems such as heart attacks and arrhythmias or abnormal heart rates, as well as hypertension. We also know it contributes to premature death and even causes cancer. More recently, it's been discovered that air pollution impacts on the endocrine system and can lead to problems with metabolism, as well as diabetes. And even more recently, it's been shown to have neurologic effects, so it can impact on brain development and learning, and even mental decline in older patients. Unfortunately, it can also cause pregnant women to have problems such as hypertension, and it can cause problems in their infants. If a woman is exposed to air pollution during her pregnancy, she's at risk of having a premature baby. The baby's also at risk of having a low birth weight and possible death during infancy. These are all very serious problems that are going on every day related to the air pollution that we're experiencing locally. Over the last few years, my research efforts have focused on trying to understand the impact of air pollution on asthma outcomes in our region. I've studied over 1,200 school children from communities residing nearby these point sources of pollution, such as the Clairton Coke Works and the Braddock Steel Mill. We found that the prevalence of asthma was about 22.4%, which is 2 to 3 times higher than the state rates reported, as well as the national rates reported for asthma. We also found that the children who have asthma have much more poorly controlled asthma than the other children in other cities. The children we studied have poorly controlled asthma about 60% of the time. In contrast, across the state of Pennsylvania and the U.S., we only see about 30 to 35% of the children having uncontrolled asthma. I also had the opportunity to study the direct impact of the Clairton Coke Works fire on asthma outcomes. I had a cohort of children enrolled at the Clairton School District, and they were all controlled before the fire. And unfortunately, when that fire happened, we were out to see them within several weeks, and about 1/3 of the children actually had worsening of their asthma that required me to change their medications. We also did a follow-up study in adults going to their physician from that zip code in Clairton, or even going to the emergency department from that zip code. And we saw that those rates actually doubled. We saw double the number of patients having asthma attacks after the Clairton Coke Works fire as before. This is sad. What Earth Day means to me is that it's a day to really respect and reflect on what the Earth has given to us, and for us to really learn more about how we can band together to fight pollution and improve our Earth as we move forward.